Medicines that can lead to diabetes. Certain medicines can make it more likely for you to get diabetes. This can surprise people, because we usually think of diabetes coming from food or lack of exercise. But some medicines can change how your body handles sugar. When this happens, your blood sugar can rise higher than normal and sometimes stay that way. This could lead to diabetes, which is when your body cannot keep blood sugar under control. Number 1, steroids are one of the most common types of medicine that can cause diabetes. Doctors use steroids to help with pain, swelling, asthma, arthritis, and even cancer. But taking steroids, especially for a long time or in high doses, can make it much harder for your body to use insulin. Insulin is a hormone that controls blood sugar. Steroids may make your liver release more sugar into your blood, while at the same time stopping your muscles and fat from soaking it up. That causes sugar to build up. Some people notice their blood sugar shoots up fast after taking steroids, even in just a few hours, but for others, the changes can come on slowly. If you take steroids for a short time, your blood sugar may go back to normal when you stop. But if you take steroids for many weeks or months, you might get permanent diabetes. Research shows that between 4 out of 10 and 6 out of 10 people on long-term steroids may get high blood sugar or diabetes. The risk goes way up the longer you take these drugs or the higher your dose. Number 2, some blood pressure medicines can also raise your chance of getting diabetes. There are 2 main types to think about, called thiazide diuretics and beta blockers. Thiazide diuretics are often called water pills. They help your body get rid of extra salt and water. But they can raise your blood sugar by changing the way your kidneys work and making your body less sensitive to insulin. If you take high doses or use them for a long time, your blood sugar could climb by more than 10 points. With lower doses, the change is smaller but can still be risky. Usually, it takes about 2 or 3 months of using these medicines to see a change in blood sugar. Number 3, beta blockers are another group of blood pressure pills. Some names include atenolol, metoprolol, and propranolol. These medicines help slow your heart down and lower blood pressure. But they can also lower the amount of insulin your body makes and raise the chances of your blood sugar going too high. But not all beta blockers have the same risk. Medicines like carvedilol do not raise blood sugar as much as others. Also, if you use a beta blocker with a water pill called a thiazide, your risk of diabetes goes up even more. Wait, there is more, but do not forget to hit the like button if you think this video is useful. Number 4, another group to be aware of are antipsychotic medicines. These are used to treat mental health problems like schizophrenia, bipolar disorder, and sometimes even depression. Research says that up to 3 out of 10 people on these drugs could get diabetes. Clozapine and olanzapine are 2 of the most likely to cause this problem. The risk is higher the longer you take these medicines and if you take higher doses. Children and teenagers taking these medicines may also be at higher risk for diabetes. Number 5, some antibiotics, especially a kind called fluoroquinolones, can cause blood sugar changes. These medicines are given for infections. The changes in blood sugar can go both ways, leading to very high or sometimes very low blood sugar levels. This is more risky for people who already have diabetes, kidney disease, or those taking other medicines like steroids. Not everyone will react the same to these antibiotics, but if you feel shaky, sweaty, very hungry, confused, or if you notice a sudden thirst and pee more after starting an antibiotic, let your doctor know. The risk seems higher with certain fluoroquinolones like moxifloxacin, levofloxacin, and ciprofloxacin. Number 6. Medicines used to treat HIV may also make it easier to get diabetes. People with HIV already have a higher risk, but some medicines increase that risk more. The greatest risk comes from a group of medicines called protease inhibitors. These drugs make it harder for your body to use insulin. Some other modern HIV medicines also slightly raise the risk of diabetes, especially if you already have other risk factors. Number 7. Cancer treatments can sometimes cause diabetes. Some immune system medicines used after organ transplants can lead to diabetes, with the risk being as much as 3 out of 10 people. Some medicines used for treating high cholesterol, like niacin, can also raise blood sugar and bring on diabetes, but the risk is lower than for steroids or some cancer medicines. Number 8. Birth control pills with high doses of estrogen can make blood sugar hard to control, especially for women who already have diabetes or have had diabetes during pregnancy. Growth hormone medicine used for children and adults with certain hormone problems can also raise blood sugar. Some risk factors make a person more likely to get diabetes from medicines. Older age, a family history of diabetes, being overweight, and having high blood pressure all increase risk. Also, women who had diabetes during pregnancy or anyone who already has mild trouble with blood sugar should pay extra attention. If you need to take any of these medicines, talk to your doctor about your risk. Sometimes checking your blood sugar more often while you are taking them is a smart step. If you notice feeling more thirsty, tired, needing to pee more often, or losing weight without trying, let your doctor know straight away. Some people may need to switch to different medicines if possible, use lower doses, or start diabetes treatment while using these medicines. For many, diabetes caused by a medicine goes away once the medicine is stopped. But if you already had some risk for diabetes, the high blood sugar may continue even after stopping the drug. Lifestyle choices can make a big difference. Healthy eating, losing weight if you need to, and regular exercise all help keep your blood sugar in a safe range, even if you must keep taking the medicine. Some medicines, like statins, are sometimes said to raise blood sugar. But for most people, the heart protection from statins is much greater than this small risk. Doctors carefully weigh the benefits and risks for each person. See the link to that video above on the screen. If you are taking a medicine that could increase your chance of diabetes, be aware of the symptoms, track your blood sugar as your doctor recommends, and ask questions during your checkups. Knowing about these risks helps you and your doctor work together. That way, you can get the best treatment for your condition while keeping your blood sugar in a healthy range. The most important thing is to share any changes in your health and follow the advice given by your healthcare team. Please click the like button and subscribe. If you think this video is useful, on the screen, you see an essential video for you. Thanks very much for watching this video. References are in the comments and description sections. See you in the next video.